Hello everyone, I'm Dr. Priyanka Singh. I'm a Retina Consultant at Shekar Eye Hospital. Today I'll be talking about aging and retina. So apart from the age-related changes which are generally seen in everyone, like reduced color sensitivity, reduced contrast, difficulty in reading, development of cataract, all these are general changes seen in most of the patients. As we know, aging affects almost all organs of the body. Hence, retina is also not exempt from that. The changes that I will be primarily talking about are the changes in the retina which is not seen commonly and not seen in everybody. But we should have information about these so that we can get it diagnosed earlier and treated earlier. First and foremost, I'll be telling you about PVD, which is Posterior Vitreous Detachment. So what happens? Our eye is filled with a jelly which is attached to the retina at almost all places, and this jelly remains slightly thicker when we are young. With aging, it becomes more liquid and it tends to move more. When this movement starts, the jelly starts separating from the retina. Now, many aged people come with complaints of floaters. That happens because of this jelly separation. Why we need to check the patient is, when this jelly separation happens, there may be bleeding or there may be tear or hole formation in the retina. In such cases, the patient will require treatment. There may be also development of full thickness macular hole and epiretinal membrane in few patients as a result of this jelly separation. Now, how do we diagnose these problems of jelly separation? If a patient has any new onset floaters, so floaters are small moving things, dots, something like mosquitoes in front of the eye. If they increase in number, or if there is a sudden appearance of floaters, or if you start seeing flashes inside the eye. Now, flashes will be like lightning passing around the corner of the eyes, generally seen when the patient moves the eye in a dark room. These are floaters and flashes which are warning signs of a posterior vitreous detachment, that is jelly separation being started in the eye. Why this warrants checkup by the retina specialist is to diagnose a hole or a tear. Now, how do we find out if there is a macular hole or an epiretinal membrane formation as a result of this jelly separation? See, macula is the center vision area which is the most sensitive area and is concerned with facial recognition, reading, etc. Why a patient generally comes to us late is because a patient is using both the eyes. Hence, the diagnosis gets missed. If you close one eye and you notice any distortion, any difficulty in reading, jumping letters, missing letters, you have to come for a retina checkup. The second entity that I will be discussing is AMD, or commonly known as age-related macular degeneration. So what happens? Retina is a very complex structure. It has nearly 10 layers, and on everyday basis, few chemicals and cells are working. There is accumulation of material inside the retina and it gets cleared in a healthy retina. With aging, what happens? The ability of retina to clear this material reduces. As a result of this, there is accumulation of debris under the retina and within few of the layers of the retina. As this debris accumulates and increases in size, when we examine the patient, we see yellow deposits inside the retina. We call those deposits as drusen's. Now what happens? Retina, which is supposed to be absolutely smooth, the debris causes elevation and irregularity of the layer of the retina. Hence the patient develops drop in vision and also might develop some amount of distortion as a result of these drusen's or deposits in the retina. With age, as the debris increases in size, it may lead to confluent drusen's, that is a bigger size drusen, and at this stage we call it as a dry AMD, as in dry age-related macular degeneration. Such patients will require regular follow-up to detect development of wet age-related macular degeneration soon. Now what happens in wet AMD? These layers of retina, they give way and lead to formation of new blood vessels, and these blood vessels lead to bleeding within the retina as well as fluid accumulation. So once there is fluid accumulation and bleeding within the retina, it leads to further distortion of the images that is formed. Now how do we treat it? We treat it in the form of injections. But treatment starts when we diagnose. Missing diagnosis is something what we have to prevent. Hence, a routine retina checkup will help you get diagnosed if you have dry or wet age-related macular degeneration and take treatment for the same. The third entity that I'll be discussing is diabetic retinopathy. So diabetics, which generally we see nowadays after 40-50 years itself, they tend to develop retinopathy. Now what is diabetic retinopathy? Diabetes tends to affect the blood vessels. It leads to leakage and fluid accumulation. It leads to abnormal blood vessel formation, which may further break down and lead to bleeding or detachment and vision loss. Now all these problems can finally lead to blindness. Hence early diagnosis by routine diabetic retinopathy screening is the key to maintaining a healthy vision in diabetics. If you have a problem, you go to the retina specialist, you get it diagnosed, you get it treated. Otherwise, vision loss, once it happens, it's very difficult to treat it. The other condition that I'll be discussing is hypertension related aging changes. So hypertensive patients generally tend to develop stiffness in the blood vessels, which leads to quick blockages, faster blockages in the blood vessels, and causes drop in vision by causing swelling in the retina. So all these patients generally will be seen after 60-70 years of age, whose hypertension has been there since more than 30-40 years and show more changes in the blood vessels. So all these changes that I discussed are seen in aging retina. Not in every patient, but if you have any distortion, any floaters, any new onset drop in vision, you have to get yourself checked. Now what do we do about our lifestyle and how to deal with all this? Maintaining a good diet, increasing the antioxidant intake in your diet, increasing omega-3 fatty acids will help. Smoking cessation is a very important thing, especially when it comes to age-related macular degeneration, because the studies have shown smoking to be directly related to worsening of age-related macular degeneration. Also, if you have any drop in vision, you should get a consultation as soon as possible. Thank you so much. Thank you for your kind attention. For more eye-related videos and for more insight into eye-related issues, please follow our channel.